People with asthma may be at higher risk of getting sick from COVID-19. COVID-19 can affect your respiratory tract, cause an asthma attack, and possibly lead to pneumonia and acute respiratory disease. The best way to prevent illness is to avoid being exposed to the virus. Take your asthma medicine exactly as prescribed. Talk to your healthcare provider, insurer, and pharmacist about creating an emergency supply of prescription medicines such as asthma inhalers. Make sure that you have 30 days of non-prescription medications and supplies on hand too in case you need to stay home for a long time. Please visit floridahealth.gov and the CDC websites to stay informed.
You are live.
Okay. Good afternoon, everyone. I'd like to call the Emergency Policy Group to order. Today is April 2nd, 2020 at 1:30 p.m. Would the clerk please call the roll?
Miller?
Here.
Silverman?
Here.
Murman?
Here.
Cronister?
Here.
Castor?
Here.
Ross?
Here.
Lott?
Here.
Snively?
Here.
Merrill? Merrill?
All right.
You've got quorum.
Hopefully thank you, sir. Hopefully he'll join us in a few minutes.
I'm here.
Okay.
I'm here.
Okay, good. Good afternoon. Good afternoon, everyone. Thank you all for joining us for our Emergency Policy Group call. We have a lot of important business to take care of today. A lot of discussions will have to be had concerning a lot of things here on our agenda and concerning some orders that came out from the governor's office last night and today. So be ever mindful of that. We don't want to keep everyone on here all afternoon. So please limit your questions and your asking of the questions, because we don't want to stay here any longer than we desperately need to. But we want to accomplish everything today we must accomplish. Okay. Having said that, is Dr. Holt on the phone?
Yes, sir.
Good afternoon, Dr. Holt. Would you give us an update on the Department of Health?
Certainly. Getting a little echo, but I'll keep going. We had 372 cases as of this morning. They are, we have 30 of those that are over 65, 46 that are 55 to 64. The state has provided me, I'm getting a lot of echo, but I'll just keep going.
Okay, hold on. If anyone has their phone off mute, please put all phones on mute. And if you're listening from a computer or an iPad or something, one of those tablets, please turn the volume down. Okay, Dr. Holt, please continue.
And at this rate, we look at the estimate that we are doubling about every 6 days. It's a little less than some of our other counties that are more impacted, but it's significant. We've certainly seen a week ago, we were averaging probably about 15 cases a day, and we're up to 30. The important point that I think I have seen and I'm concerned about, just to share, is that as we get more information from other countries and experiences in science, COVID-19 is clearly demonstrating it is much more insidious and contagious. Transmission prior to illness or in very mild cases is clearly documented. And there may be some degree of what we call aerosolization, which is more distance type of thing that could be beyond the 6-foot range. Our focus from the health department remains looking at every case, identifying those that have the highest risk for causing outbreaks, clusters, we call them, in our most sensitive situations, such as congregations of nursing homes, long-term care, or healthcare workers. We have been working and had a meeting with the medical directors about the outpatient care system that we are coordinating, and I'm hoping by early next week, the health department will have a means to track every patient within those systems so we can do our part make sure that they are cared for outside the hospital and fully recover as quickly as we can. We've also started discussions with the hospitals regarding the surge plans that would be needed in the event some of the worst case scenarios arise. And then again, I remain very focused on the long-term care facilities and what we can do to ensure that they are protected or promptly respond to if they have a case. We have been receiving this week reports from the ambulance company that is investigating or inspecting and contacting each of our facilities, giving us information on their needs and their status regarding PPEs and compliance with some of the expected and required practices they have in their institution. I'll stop there.
Okay. Are there any questions of Dr. Holt?
Chairman, this is Mayor Castor. I have a question.
Yes, Mayor Castor, recognize.
Hey, Doctor, you talked about the increase, the doubling every 6 days of the positive tests. What are the numbers on the actual test, the test kits? Do you have that information at hand?
I do not, ma'am. The numbers that I have, don't account for all of the tests that are being done throughout. The community. I just have the numbers that are coming in positive, and as they have been run, the majority of them we can't track because they're done by LabCorp and Quest, who don't tell me how many of them are from our county. I just get the positive results.
Okay, thanks.
Are there any other questions of Dr. Holt?
This is Commissioner Overman, Chair. I have a question, please.
I'm sorry, I can't hear you.
This is Commissioner Overman.
Yes, Commissioner Overman, you recognize.
I have a question, please. Thank you, Chair. It's my understanding that we have 224 ventilators, but we're waiting to hear back from a few hospitals. Can you tell me the estimated date for a final count of the existing ventilators we have within the county and the expected date to receive the 500 ventilators that were mentioned for Hillsborough County, that were mentioned at the last EPG meeting?
What I am expecting and been told is that we will have that information a week from today, by Thursday, tomorrow. Today is, I'm sorry. Friday. Oh, I'm sorry, by tomorrow. I apologize, I'm getting misunderstanding of my message from my staff right here. It will be by tomorrow.
Excellent, excellent. And can you share with us what you're experiencing with the county and the commercial lab results as far as testing and pending testing? What should be expected as the anticipated delay on positive and negative results once the test is taken?
Yes, ma'am. They really break down very much by where they're collected. Tampa General has the quickest turnaround time, less than 24 hours. But again, they are limited in how many they're testing and their focus of where. The Department of Health is running it's probably closer to 48 hours now, just with the volume, the number they're getting. So it's not all of them are run the day they arrive. They're put in the next day. Quest and LabCorp, the numbers that we have are 5 to 7 days, but the range is, as the results are coming back, are huge. It's 3 days to 12 days by individual cases. I'll stop there.
Thank you.
Any other questions of Dr. Holt? Any other questions of Dr. Holt? Dr. Holt, that concludes your presentation?
Yes, sir.
Okay, thank you, Dr. Holt. Again, I'm going to ask whoever it is, someone has their phone unmuted or they have one of the devices, the sound up. We're getting a lot of feedback on the call. Please put your phones on mute and wait till if you want to be recognized to speak, then take it off because we're getting a lot of feedback, okay? Emergency management update, Mr. Dudley.
Good afternoon. Tim Dudley, County Emergency Management Director. Current EOC actions, logistics has entered over 1,000 resource requests to the state on behalf of the public-private entities in the county. Collection site update. Yesterday, they collected 195 samples. Currently plans to continue collections in an availability of kits. And with that being said, we did receive another 1,000 kits yesterday. So that gives us a little over 2,000 kits that we continue to work through. We had 413 appointments that were scheduled for today, and we will continue testing using the current inventory received yesterday, starting up again Monday through Wednesday. We'll continue with our scheduled collection through this Friday, and then we'll pick it up again Monday through Wednesday of next week. Q&I quarantine and isolation facility. We did an opening this morning. All staff is on site, briefed, and ready for business. Alternate facilities. We participated in a conference call with medical directors, the administrator, Mike Merrill, and the Department of Health to continue discussions of surge planning. That concludes my update.
Thank you, Mr. Holt. Mr. Dudley, is there any questions of Mr. Dudley? Any questions of Mr. Dudley? Okay, very good. Thank you. Federal and state legislation update, Mr. Wagner.
Thank you, Mr. Chairman. This is Brandon Wagner, Chief Government Relations and Strategic Services Administrator. At the federal level, as you are aware, the President has extended the National Slow the Spread campaign through April 30th. I'd also like to update you on the implementation of the CARES Act that was signed into law last Friday as part of our report. As you remember, it's a $2.2 trillion financial assistance package. Federal agencies are currently unpacking the act and still trying to determine how to quickly and effectively disseminate that funding. Those release times are going to vary by agency depending upon the requirements of the law. Here's a couple of relevant updates that are good for today. HUD is set to announce the following supplemental allocations for Community Development Block Grants, or CDBG. $4,286,411 to Hillsborough County, through which Plant City and Temple Terrace will also receive an allocation, and $1,894,705 to the City of Tampa. Also under HUD Emergency Solutions Grant, $2,129,659 to Hillsborough County, of which Plant City and Temple Terrace will also benefit from these funds, and $963,359 to the City of Tampa. As well, Department of Justice Bureau of Justice Administration has announced its supplemental funding. Allowable projects and purchases are things such as overtime, equipment, hiring and supplies, and training for law enforcement and medical personnel. Hillsborough County is eligible for $464,297, through which Temple Terrace will also be eligible to apply. Plant City, $42,217, and the City of Tampa, $463,911. Finally, U.S. Treasury is set to open a web portal for the $139 billion state and local relief fund next week, with additional guidance to follow soon thereafter. Their stated goal at this point is try to get the money out by April 24th. Looking ahead legislatively, planning is underway for phase 4, fourth tranche of things for COVID response. U.S. House leadership announced yesterday their intention to advance an infrastructure bill based on their moving forward framework that was originally announced in January. And that would be a $760 billion package over 5 years to address roads, bridges, and other transportation systems, including drinking water, wastewater, brownfields, and broadband. Word at this point is the package may not be rolled out immediately, until the CARES Act is fully implemented and engaged. At the state level, as the chairman indicated at the beginning of the meeting, the governor issued 2 executive orders, a statewide safer at home procedure that's good through April 30th, and then a subsequent executive order amending and clarifying that the safer at home supersedes any conflicting action issued at the local level. And your next agenda item will go into greater detail on that issue. Mr. Chairman, that concludes my report, and I'm happy to answer any questions.
Thank you, Mr. Wagner. Are there any questions of Mr. Wagner? Any questions of Mr. Wagner? Okay, thank you, Mr. Wagner. Governor's state of the order issues from yesterday and today. Who's going to be handling that, Ms. Beck?
Yes, Commissioner. This is Christine Beck, the Hillsborough County Attorney. Good afternoon, APG board members. I also have 2 senior attorneys from my office available if they should be needed for questions, Jenny Tarr and Robert Brazel. We have been asked to address the recently issued orders by Governor DeSantis, and we sent a very brief summary by email in advance of this meeting just for ease of reference. But the order number 20-91 was issued yesterday. Order 20-92 was issued today. And as Brandon said, both of them are effective at 12:01 a.m. tomorrow, and they're effective for 30 days. This morning, we had a conference call with counsel for the various EPG members to ensure consistent interpretation of the state orders. We believe that the state orders expressly preempt local jurisdictions. Therefore, local emergency orders must be consistent with the state order, and the state order supersedes anything that would be in conflict at the local level. I'm going to just hit on a few of the key provisions in these orders. In Section 1B, it states that all persons limit their movements and personal interactions outside of their home to only those necessary to obtain essential services or essential activities. Essential services are then defined to include the Federal Homeland Security Guidelines document, which is dated March 28th of 2020. The federal guidelines were recently updated, and the state orders refer to that. In addition, the essential services include those businesses and activities that were designated in the Miami-Dade order, and that order is attached to the state order. In the time that we have had, we have attempted to compare the list of the essential services in our order with the state's order, and it appears to be mostly consistent with the state order. However, the state order does have a provision whereby essential services may be added if approved by the state coordinating officer. The essential activities in the state orders are defined to include attending religious services, recreational activities with social distancing, taking care of pets, caring for or assisting a loved one or a friend. And pursuant to the state order, a social gathering in a public place is not an essential activity, and groups greater than 10 are not permitted to congregate in a public place. Since the state mandates that religious services are an essential activity, the state does not place any limitations on the number of people who can attend religious services, nor does it address the 6-foot distancing requirement as the state order does, for example, with regard to the recreational activities. The state order does not prohibit encouragement of the 6-foot distancing or other CDC guidelines, however. The governor's order also does not explicitly close all non-essential businesses, but it appears to show an intent to do so. And that is based on the section I previously referred to, where all individuals are to limit their movement to only those that refer to essential services or essential activities. So that provides a very strong inference with regard to non-essential businesses. I will stop there and be available for questions.
Ms. Beck, thank you very much. Let me ask a question, because my phone is going off the hook concerning the religious activities. We don't understand now that a religious, a church or a synagogue or whatever the institution is, can now have services, and as many people as can get in there can attend, and we're encouraging them to be 6 feet apart, but they don't have to be 6 feet apart, and there's no limitation on the 10 people or less. Am I right? Is that what you're saying?
That's correct, Chairman. The state order does not put any limitation on the number of people.
So, we just got a article that came out about in Albany, Georgia, which is suffering like mad now because the virus has almost taken over the whole city. Where it all started with a funeral, 2 funerals where people packed into the funeral, and just about everyone now in that funeral, the width of those funerals have the coronavirus, and some of them have died. So I want to make it perfectly clear to this group that now churches can have their services, and as many people can get there as they want. There's nothing in the governor's order that says they have to be 6 feet apart. Right?
That's correct.
The other thing is the essential businesses. I understand you to say that the businesses that we have in our order can still remain as essential businesses in our order. That the governor's governor's order does not supersede those.
What I was saying is that the essential businesses in our order are consistent. I didn't see any that were not included in the state order. If we should find one or have one that we would like in the future to be included, there is a process whereby we can seek that approval from the state.
So our hospitals better get ready. That's all I got to say. Any questions? Any questions, Ms. Beck?
This is Mayor Castor. I have a question.
That
was your interpretation that the church, because I read that and I didn't see specifically where religious services were exempt from the numbers and the 6 foot distance separation. That's your interpretation of that, but it doesn't specifically say that in the order, correct?
Yes, it's based on preemption analysis and the language about the order superseding. I can share with you that I've seen newspaper reports where it does appear that local jurisdictions are taking different interpretations of that.
Well, we can probably all see how we would take a different interpretation. I mean, it makes no sense. The one thing that has shown to flatten the curve is the distance separation. So I would hope that wasn't the intent of the governor's order.
Well, I hope, and thank you, Mayor. I hope that wasn't the intent also, but I do hope that if we get no more clarification from the governor's office, that these religious institutions, if they're going to open their doors for service, use the best possible judgment they can in saying, stay 6 feet apart. Please stay 6 feet apart. Because as you said, that's the only thing we can see that will flatten that curve. But what I'm seeing here now, that curve in Hillsborough County in this state is not going to be flattened anytime soon. Any other questions, Ms. Beck?
Mr. Chair, can I ask a question? It's Commissioner Murman.
You recognize.
Thank you. And I asked this to Christine. I mean, can the EPG suggest guidelines for holding church services? Suggest,
Yes.
not
Yes.
require.
Yes, I think we would all agree that strongly urging would be appropriate and allowed, and that is the way the Miami-Dade order is written, to say that persons attending religious services are urged but not required to practice social distancing, such as keeping 6 feet between persons and limiting group size.
Okay, I mean, Mr. Chair, I think maybe there's, and I know Mayor Lott is doing something at his church in Plant City. I wasn't sure exactly what it was, but somebody was telling me about it, which kind of meets what we're trying to do here and make suggestions to the churches to be safe. Maybe Mr. Mayor Lott can respond to it.
He's on the phone. Mayor Lott, would you please clarify what's happening with your church, sir?
Well, we've had a few of our churches have drive-in ceremonies where the participants park in the parking lot, they stay in their cars, and no more than 10 people are outside of their vehicles. And I think we've had 2 or 3 services like that, and they've gone with no issues whatsoever because everyone stayed in their cars, and they transmitted the sermon over a shortwave radio or over the radio station somehow. And but that has worked well, but we haven't had anyone have any services inside or congregations inside the churches to break the 10-person rule at all. Okay, does that clarify everything?
Yes.
Yeah, thank you very much.
A lot.
Thanks.
Mr. Murman, you still have the floor.
Okay, so, Mr. Chair, I mean, I do think, and I don't know if I need to make a motion on this, but I do think it would be upon us as the emergency policy group to at least put out some suggested guidelines to help keep people safe. Like the mayor said, we're flattening the curve, and just keep people at a safe distance and in small groups. And I don't know who would provide that language or how we would distribute that. I guess our communications folks could work that out. But I do think that's something I strongly recommend that we do, just so we can say that we took some responsibility on this and tried to keep it safe.
Well, Commissioner Murman, hold your point right there. Let me ask Ms. Beck something. What Commissioner Murman is suggesting and talking about, do we put that in the order, or that's just something that we as an emergency policy group put out as a suggestion?
I think if the emergency policy group wants to do that, then they can just make that motion and we would implement it not through an order, but through, as Commissioner Murman said, our communications department to try to promote that as much as possible.
Thank you. Commissioner Murman, you recognize again.
I would. I'm going to make a motion that we ask our communications department, and also I'm sure the mayors of the 3 cities would have their communications staff, but we would have one unified message delivered to all the churches in the area to, suggest the safe guidelines, against this terrible virus that's pounding us.
Is there a second? Is there a second?
Commissioner Everman will second that.
Oh.
Somebody's on hold.
Put that phone on hold. James, can you tell who that is? Brooke?
Not Castro.
Commissioner Miller,
Not
this is
tonight.
James.
Pardon me?
Commissioner Miller, this is James. I do not have the ability to tell you who is pumping that music into this call. I can tell you that we have 32 members on this call, and that's significantly more than we've had in the past.
So it's probably not a member of the EPG, it's just someone that called on this phone.
Potentially,
Okay.
yes, sir.
Members of the EPG, can you hear me?
Yes.
We can hear you, and it is a county phone, because that's our county phone.
County phone, okay. If I find out who that is, then you can hear me. I have a motion by Commissioner Murman, second by Commissioner Overman. Commissioner Murman, I want to hope that you can include the Sheriff's Department's communications people involved in that also, because there are going to be some churches asking whether the sheriff's going to come out and do whatever he has to do. So include the sheriff's communications people in that motion also.
I agree.
Mr. Chair, Mike Merrill.
Hey, Mr. Merrill.
So we have Joint Information Center through at the EOC.
So I can
And the Joint Information.
Hello?
Sorry, the Joint Information. Yes, can you hear me now?
Yes, go ahead.
We have a Joint Information Center, the JIC, at the Emergency Operations Center.
Okay.
That's where the message should come from, the Joint Information Center, which incorporates all of the community partners.
Okay.
I agree. I forgot about that center. Thank you, Mr. Merrill, for bringing that.
Okay. Thank you. All right, we have a motion by Commissioner Murman, second by Commissioner Overman. I hope the clerk can hear me and the clerk will speak loud enough to call the roll. Somebody finally came back on the phone. Clerk, please call the roll.
Yes, sir. All right. Miller?
Yes.
Overman?
Yes.
Murman?
Yes.
Cronister?
Yes.
Castor?
Yes.
Ross?
Yes.
Watt?
Yes.
Snively?
Yes.
Motion carried 8-0.
Thank you very much.
Mr. Chair?
Yes.
Could the motion be repeated for the record, now that it's clear?
Yes, Commissioner Murman, would you please repeat that motion, but it hasn't include the Joint Communications Department at EPG. Go ahead, Commissioner Murman. Commissioner Murman?
Yes. Through the Joint Communications Center that we would issue, what do I call it? Suggested guidelines for safety. That would include distance and group requirements, just to keep our churches safe, and that would be distributed to every church. Good luck.
Okay. Pardon me?
Nothing.
Okay, all right. Ms. Beck, was there anything else you need to bring forth?
No, sir.
Okay, thank you. We now move to the extension of the Hillsborough County emergency order. Who's handling that? Ms. Beck?
Yes, Commissioner. This is the routine order that we have to do every 7 days pursuant to Florida statute to extend the state of emergency in Hillsborough County, and it would be appropriate to entertain a motion for that at this time.
Is there a motion?
Mr. Overman, so moved.
I'm sorry, two people speaking. Who was that again?
Commissioner Overman, I'll make the motion, please.
Mr. Overman makes the motion. Is there a second?
I'll second. Commissioner Murman.
Second by Commissioner Murman. Is there any discussion on the motion? Any discussion on the motion? Hearing none. Please call the roll.
Miller?
Yes.
Overman,
Yes.
Murman,
Yes.
Cronister,
Yes.
Castor,
Yes.
Ross,
Yes.
Lot,
Yes.
Smithley.
Yes.
Motion carried 8-0.
Okay. Mr. Merrill, I'm gonna call on you. Is there anything you would like to bring before the body at this particular point in time?
No, I have nothing else to add.
Okay. Is there any other discussions from the members of the EPG? Any other
Commissioner
discussions?
Overman, I'd like to make a suggestion.
Hey, Commissioner Overman, you recognize?
Dr. Holt has given us very good guidelines on how to keep people safe. And employers and now our churches may have good information on any of their members or employees that have experienced risk. In other words, they believe they're infected, they may or may not have a test, or they may have tested positive. In the order we just approved as guidance to our churches, can we ask our churches to report to the Department of Health in the event that they've had one of their parishioners take ill?
Got a question to Dr. Holt?
It is a question that Dr. Holt be consulted on best practices on the guidance or advisory that we put into that motion and how it's communicated.
But you asked a question: if a church has someone that is ill, could they report? And my question is to Dr. Are you asking that of Dr. Holt?
Yes.
Dr. Holt, are you still on the phone? Dr. Holt? Well, he's not there.
Well, I'm sure the staff can probably address that issue when they prepare the guidance, but I just think it is important that we ask our employers as well as our churches in this case to help us identify where community spread may occur.
Duly noted. Any other discussions?
Thank you, Chair.
You're welcome. Any other discussions today? Any other discussions? Our next Emergency Policy Group meeting will be this coming Monday, which is April the 6th, I believe, at 1:30 p.m. And the call-in number and agenda will be forthcoming from staff. There's nothing else to come before us today. Have a great weekend. Be careful. Stay safe. Observe 6 feet apart. And we'll talk to each other on Monday. Be blessed. Thank you. We're adjourned.
Thank you.
The test to prove whether the person is positive or negative for COVID-19. We encourage social distancing because it is very easy to spread through droplet transmission, meaning if someone coughs or sneezes near you and you breathe that aerosolized matter in, you are now possibly infected with the virus. We want to isolate the sick for 14 days because that's typically the duration of this virus. At the end of the 14 days, if they are symptom-free, then they have the potential of testing negative for the virus. But they do have a clearance process for those individuals. For the latest information on the COVID-19 virus, we encourage everyone to visit the Florida Department of Health and the CDC websites.
People with asthma may be at higher risk of getting sick from COVID-19. COVID-19 can affect your respiratory tract, cause an asthma attack, and possibly lead to pneumonia and acute respiratory disease. the best way to prevent illness is to avoid being exposed to the virus. Take your asthma medicine exactly as prescribed. Talk to your healthcare provider.